So right now we're going to go over how we track a client and a client's progress in a concise and immediate and effective way. I'm going to show you a draft version of what I use and what I'm tracking and why it's helpful, why I'm tracking each of the things that I am tracking. And you can obviously create your own version of this or different altogether, but I've found that this is an efficient and useful way to track clients. So the tracking form, all right, this client is just John Smith. So we have the date, okay, and this is going to be his series of dates that he got treatment. These are all his treatment dates. So here's just the first three. So 5/26, 5/28, 6/1. And when you have a long list here, you know if there's been a gap, is he going once a week, etc. So it's useful not just for now, while you're actively treating a client, but also if you haven't treated him in a year. And you can see concisely what happened last time. So that's the date. And this is the number of stimulations from last time. So this John had 6, and then 6 again, and then down to 3. He's become more sensitive here, and it required less stimulation. And another thing we track, and we haven't talked much about, but is important, is duration. How long does the effect last? So here it's lasted 2 days, 2 days, 3 days. And this is very useful for a couple reasons. One is, so you can see that there isn't that much progress in general for the first 10 to 12 or so days. But once it's lasting about 2 weeks, then it goes up very significantly each time. Another reason duration is so important is, let's say, again, it's 2 days, 2 days. Then you had to put 3 days. And then what you found out is that he got really overstimulated with 3 days, even though it's less than last time. He got really overstimulated. And this relates back to the core concept, the core principles that we use in treating clients. And I'll mention them again now, but you really have to know each feature of them. Not in the wording that I use, but each one is a staple of how you think about treating clients. Now, when you think about it, treating clients, there's only one question. Everything comes down to, really, is when to give more and when to give less. Now, there's a lot of subtlety and variations within that. It's not so straightforward as it may sound, but really, it pretty much always comes down to when to give more, when to give less. And one way that we track it or are aware of it is the second fundamental, I think of it as the first fundamental rule, is how do you know how much to treat someone? And it's treat someone until they respond. So it doesn't matter, with some slight exceptions, if they're vulnerable. It doesn't matter what the disorder is. It doesn't matter where they're from. It doesn't matter what their symptoms are. It doesn't matter if it's a head injury or a skin problem, that we treat until they respond. But there is one huge exception, and that is the first session. And the reason is because there can be a gap between a treatment and a person responding. So that gap may be a few minutes, a half hour, a few hours, occasionally 24 hours. But when we're treating someone in that first session and they haven't responded yet, we don't know if we haven't given enough stimulation, or whether we have given enough and perhaps even too much, but we don't know it yet. So we limit how much we give in the very first session. And that's really critical. Otherwise, you can easily overstimulate someone that you don't want to. And so I only go up to so many stims in the first session. Let's say maybe 7 or 8. And then I stop, whether they've experienced anything or not. And if they haven't, all right, I'll see them again the next session. But this is really why some people take 2 sessions to respond, not just the first. And that's because there's a gap, a delay, and we limit how much what they give. So in general, in these cases, they actually need more. But you have to be aware of both possibilities and limit how much you're going to do. Finally, when they come in the next time, you know whether or not they got overstimulated or not. And if they didn't, then they're not all that sensitive, and you can feel a lot more comfortable giving more stimulations. And if they are, that you gave them too much, well, then you have to deal with their hypersensitivity. We'll get to hypersensitivity in a few moments. When you're treating someone and you're tracking the days, the duration, and it's lasting 2 days and 4 days and 6 days, and then the next day it's down to 3 days and 2 days. Okay, what does that tell you? How do you respond to that? And it's counterintuitive. But when it's lasting fewer days, then you give less, not more. When it's fewer days, you give less, not more. On the other hand, when the days isn't really changing very much, but they're not experiencing the session as much, then you have to give more. So if they're not getting the results as vividly as they have been, then we need to give more. And one question I'll sometimes, if I suspect that might be going on, my question will be not, are you relaxed now, but are you as relaxed as you've been the last 3 or 4 sessions? So I have a reference point. And then sometimes they'll say, well, no, not really as relaxed. I'm relaxed, but not really as relaxed. And so you know a little sooner whether to give more and whether to give less. And you'll notice with each circumstance that I describe, it always comes down to when to give more and when to give less. But there's a lot more subtlety, again, and nuance to making that decision than at first seems apparent. So that's why we track duration. And especially when it's going faster, that we're getting up there. I know someone's making good progress if it went from 4 days to 12 days or 8 days. Then that's about as good a marker of progress as it is tracking the individual symptoms. So duration is very important, and I track it since the last session. And then here are the symptoms. I usually do it, the 4 most relevant symptoms to that client. And I track them. You can add to this, etc. But I use the typical 1 through 10 scale. And I can track whether it's going down, 7.54 with depression, whether it's getting worse, the anger, whether it's staying the same, insomnia, and anxiety is going down a little. So you're seeing some change, but not all that much. And it's really helpful to see them over time in this kind of way to get a picture right away of where we are with that client. You have the key variables to make an assessment. You know how many stims they've had or cycles, whether the duration has been getting shorter or longer, and how effectively the symptoms are being treated, and whether they're experienced as strong as before or not so much. Now on the right is comments, and like I said, this is still in draft form, and there needs to be more room for comments. And but that's what I use to track my clients, my patients. It's very simple. Another actually little thing that I do is when I'm done with a session, I have a really good sense of where we are with that session. And so I put in for next week what I think I'm going to need the following session. So there's no time that I have a better sense of where that client is right now. And so I should give it my best assessment right now. And I put it in small numbers or some way of identifying it. And I know that that's what I thought the last time when the last session ended. And then when I hear more what's happened in the intervening time since last session and now, and how he responds to treatment now, this may change. But I find it very useful to know what I thought at that time. This is our tracking form. There's one other area that I'd like to talk about for just a few minutes, and that's overstimulation. I want to talk about overstimulation and also the current that a client gets, and what does it mean for a current to be stronger, to have a stronger or weaker stimulation. Well, answering the last question first, the actual amount of current never varies. Never varies. It's always the same. So though we say getting stronger, giving you a weaker dose, it implies that it's the strength of the current, and it's not. A stronger dose is length of time up to a point. Okay, there's something called the dose response curve. And the dose here to here, as the dose gets higher, then the response gets higher also. And we have a line, a 45-degree angle. And that's the classic dose response curve. But here, what happens is, if you keep giving it longer, instead of continuing to go up, the dose plateaus, it flattens out. The response, plateaus and flattens out. And in fact, it can go down and have less of a response than the length of time the person got the treatment. So be aware of that. That's why I limit actually how much I do give a person now. I usually don't go above 30 stims just because I haven't found it helpful. I mean, out of curiosity, I've given someone 100 stims. Didn't notice anything at all. So don't be afraid. One thing is, don't be afraid of giving someone more, whether it's 20 stims or 30 stims, because you'll end up not really giving more of an effect, and in fact, may very well be lessening the effect. And remember, this is direct neurofeedback is weaker than a cell phone. So if using a cell phone, whatever you're nervous about, doesn't bother you, then this shouldn't either. So that's what we mean by giving a more or a higher dose. It's not really a dose, it's duration. And up to a point, duration is gives a stronger response. Then it plateaus and can even go down. This is tracking. It's not complicated. This is efficient. You get just the information that you need, and you can take it all in essentially at a glance and know where you are with that client.